It's a celebration years in the making as this woman proves mother's dedication has no limits. Meet her and her young son who fights a rare disorder. Coming up now on the Morning Medical Update. And good morning. It is Thursday, November 17th. I'm Jessica Lovell. We are live inside the Dulcie Simons Jr. Family Broadcast Studio this morning. Today, we explain Eagle-Barrett syndrome, also known as prune belly syndrome. It's a rare disorder that leaves you with a partial or complete lack of stomach muscles. We'll talk with this young mother and son duo and the team of doctors from 2 hospitals who helped save this young boy's life. So make sure you get your questions sent into us on YouTube, Facebook, or email us at the Medical News Network. You can find links to all of those right there on your screen. Heroes do truly exist, especially for those waiting for someone to step forward with a life-saving organ donation.
One of the things you talk about with surgery and medicine is first do no harm. Well, here we are to help someone else. So it's the ultimate gift for someone to put themselves at risk to do this for a loved one.
Well, you're going to meet Brendon and his hero, his mother, Jessica. She faced a long journey herself to become healthy enough to try and save her boy.
You would expect someone about to have major surgery to feel all sorts of emotions, and that's true for 38-year-old Jessica Meza. But all of her emotions are focused on a little boy who at this moment is being prepped for his major surgery 4 miles away at Children's Mercy Hospital.
He's amazing. He's the most amazing little boy.
Jessica is donating her kidney to her 5-year-old son, Brendon.
Brendon's had a lot of anxiety regarding this, almost like whenever you mention transplant, he just kind of gets very frantic. So that's my thing, is I can't be there to comfort him. I can't be there to reassure him.
Brendon has Eagle-Barrett syndrome, commonly known as prune belly syndrome. It means he was born without a full wall of stomach muscles. The syndrome comes with a host of other problems. Brendon was also born with stage 4 kidney disease. He was in kidney failure and on dialysis before he was even 1 year old. But 6 weeks ago, Jessica finally got the call she was approved to donate her kidney. It has been a very long and very dark road leading up to this day.
So I did a workup about 3 years ago, and they told me at the time that I needed to lose 20 pounds. So I thought, no problem. I ended up getting pregnant, and then I had a miscarriage. And then COVID happened, so everybody was gaining weight. And Brendon had a stroke at that time too in June of 2020.
Jessica buckled down, ultimately losing 50 pounds.
It's a big gift for somebody to do this, and not every person would do this.
Transplant surgeon Dr. Sean Coomer leads the team removing Jessica's kidney.
Yeah, it's one of the greatest responsibilities and greatest honors at the same time.
The surgery takes about 2 hours from first cut to last stitch. But before he fully removes Mom's gift of life from her body, Dr. Coomer makes one final call to Brendon's team of doctors at Children's Mercy Hospital.
Are you good? You okay for me to proceed and get it all squared away, and not cross-claim?
Kidney out, Dr. Coomer delicately prepares it for little Brendon and his waiting surgical team. Before this surgery, we had asked Jessica and Dr. Coomer if they had any messages for Brendon, who will one day grow up and see this story.
Your mom saved your life, gave you life, saved your life, and continues to love you.
I wish I could have done it sooner, but I know that this was the perfect time.
And please welcome Jessica to our program this morning. Jessica, how are you today?
I'm doing good.
Good to see you. Along here in studio with us is transplant surgeon Dr. Sean Coomer here with the University of Kansas Health System. And our team from Children's Mercy, we're hoping is going to join us here in a moment. They are on call and very busy, as we know, there at the Children's Hospital. Okay, I think Dr. Hendrickson is back with us. Good morning, Dr. Hendrickson. How are you? I think you might be on mute.
Can you hear me?
I think we can hear you now. So good to have you. And I know you're on call this morning and very busy. And one of those reasons is I'm going to bring Jessica in to kind of explain a lot of what's going on, because I know you've had a rough couple of weeks because Brendon has been in the hospital with RSV. We've been talking about this quite a bit over the last month or so. How are you all doing? How is Brendon doing?
Brennan's actually doing great now. He's in good spirits. I think the RSV has passed. So while we were in the hospital, we found that he had an infection in his bloodstream and central line. So they're currently treating him with antibiotics through his central line. Hopefully we can go home today or tomorrow, but he seems to be taking it well. He's in good spirits. You know, he's silly, goofy, interacting with the staff. Just what we could hope for.
Silly and goofy. That's what we like to hear. Fantastic. So how are you both feeling after your surgeries?
Well, Brendon is doing awesome. We noticed a difference immediately, just the energy levels that he had, and just not being sick anymore. He used to throw up every single day, and now he's not throwing up at all. So that's really refreshing to see. For me, it took a little bit longer to feel good. I think I'm finally at that point, but it's definitely not something to be taken lightly. I definitely underestimated it, and it took a long recovery, which I thought I'd never get through, but I feel good now.
Dr. Cooper, is it true that the donor often feels worse than the recipient?
Absolutely. It is a tough surgery. It's a very painful surgery. It goes transparent needle, so we're obviously taking an organ out. It is very painful.
And you're very upfront about that when you go through these processes to let them know. But,
absolutely.
But when you're dealing with a mom and a son, there's a lot a mom can take, right?
Oh yeah. I mean, moms they're heroes. I mean,
That's right.
No, not even beyond this. Moms are heroes.
Yeah, moms are heroes before they even get to any sort of donation of their kidney. But you're extra special, Jessica, and we know that. I want to reintroduce our team from Children's Mercy here in Kansas City. Pediatric surgeon Dr. Richard Hendrickson and transplant surgeon Dr. Bhargava Mulapudi. Doctors, how are you today?
Great. How are you?
Good. Thank you for being with us. I want to find out how this all came together. Dr. Coomer, how did you coordinate with the team at Children's Mercy on our end to make all of this happen? How does that work?
Yeah, it's a really great relationship. We've had this for a number of years. You know, we have a significant number of adults, often parents, but often some others as well that want to donate to a child that's a patient in Children's Mercy. And a number of years ago, we developed this partnership, and it takes a huge team to kind of get there. Usually what happens is the patient's being evaluated at Children's Mercy, and then they're looking for living donors, and then they send them over to us. And then we evaluate those donors to get to that point. And then we jointly kind of figure everybody's schedule out and time it so it works well.
You have a whole team of coordinators that do all of that.
Yeah. It is a huge team.
It is a big undertaking and well worth it. So is the reason that you take on Jessica as the patient here is because she's an adult and her son is the pediatric patient? Is there any way that you would ever do it under the same roof, or no need to?
Yeah, there's such great specialties, right? When you think about, so we do a great job with adult medicine and surgery here, and Children's Mercy is, one of the finest at delivering pediatric care. So it just works well. We're right down the street from each other. Why shouldn't we get along and do things right and do the best thing for the patients?
I thought the coolest part of that story, and I asked you, I said, does that really happen? Is that you had them on speakerphone saying, hey, are you ready for me to take this kidney out of Jessica right now? Are you guys ready over across town to receive this kidney? Tell us about what that phone call is like and why it's so important to time this out perfectly.
Absolutely. It's one of those things that we like to keep the kidney on ice as little time as possible. And we want to make sure they're proceeding and don't have any hiccups that they didn't anticipate. Same on our side. So we just, a quick phone call just to make sure everybody's on time and proceeding as they expected, and then we proceed.
Ready to receive that kidney. And this is you and your OR, correct?
Correct. This is us removing the kidney.
So, Dr. Mulapudi, jump in and just kind of tell us on your end what's happening across town as you await that kidney to then put inside Brendon.
Absolutely. So Dr. Hendricks and I were the two transplant surgeons at Children's Mercy. So we kind of work together on everything. We coordinate everything together. So once we have, Brendon down, we'll kind of meet him in the pre-op. We'll go over the anesthesia, our day planning and stuff, and then we go back to the operating room. He goes to sleep, and we're sort of like start to kind of get things arranged, and we keep in touch with with Dr. Kumar, basically kind of looking at how far along are you in the case, because we have about maybe half hour to 45 minutes of work to do once we make the skin incision before we're ready for the kidney itself. So that's how we sort of like time, and we we keep going.
Dr. Hendrickson, are there any additional risks when operating on someone with prune belly disorder? And like I'm sure many of our viewers had never heard of that before. So maybe kind of help us understand what that is and what maybe some of those challenges might be.
Yeah, it's very challenging. Actually, I've known Brendon probably since before he was 1 year old. And probably one of the smartest kids I see him. He's one of the smartest kids you'll meet. He's extraordinarily bright. Hey, Brendon. Hi. I've operated, and my colleagues have operated on him over 10 or 15 times. Various reasons from his prune belly, lack of abdominal musculature. One of the first things I did was put a feeding tube in there, which there's not a lot of history or case reports about doing that. Will that actually heal in there? And talking with the mom, I've had a great relationship with her for about 6-7 years. So that was the first thing. But he's had multiple operations, and that's where that phone call you just described before is important, to make sure when we get into the area we need to for him, we're ready for Dr. Kumar to go ahead and clamp the kidney on the other side and minimize that cold ischemia time. So he's extraordinarily challenging. He's really smart, as alluded to before. He had that issue a couple years ago. So there are a lot of challenges for him, but he's done well. He's got a great family. And hey, Brendon.
Here he is. Spider-Man has made his appearance.
Yeah, there you go, bud.
Jessica, how is Brendon doing this morning?
He's good. You good, Brendon?
Hey, pal. Good to see you. Looking good.
Big muscles.
I love it. I love it. Dr. Kumar, something that Jessica talked about in her story was her need to lose weight. She was on a quest to lose 30 pounds, then COVID hit. We know what that did to people, putting on extra weight. Then she wanted to lose 50 pounds. Why was that weight loss so important? It doesn't seem like a lot of weight, but why does that make such a difference when you're a donor?
It has to do mostly with recovery. As we talked about sort of the top of the show, we first do no harm. Now, obviously, we want to make sure that Brendon gets taken care of and gets the kidney he needs and deserves, but we also don't want to harm his mom. He needs his mom. He wants his mom around, and we do too. And so we want to make sure that she has the best and the most optimal chance of recovery. And I think Jessica will probably tell you there was no walk in the park. It was painful. It was tough. And when you have extra weight, it has increased chance of diabetes and wound complications and all sorts of other complications that can occur. And that's why we do that.
And we've talked about this. This pressure is on you. You've even said this before. You're like, everything lines up. And then it's like, Kumar, don't screw it up, right?
Yeah, right. It's a pass-fail operation, right? So Dr. Malapudi and Dr. Hendrickson got to be the heroes. I want to make sure I didn't screw that up for him.
Well, and I appreciate that, though, because you're saying, look, I've got this pressure on me to make sure that Brendon's mom is healthy and can make it through the surgery and the recovery. And so you have to have these strict guidelines to make sure that she can get there as quickly as possible, right?
Absolutely. I mean, it's a lot of pressure, but like I said, it's one of the greatest honors that I get to be, to do.
So I want to ask our Children's Mercy doctors, Dr. Malapudi, how do you prepare a child for a surgery like this? Or Dr. Hendrickson, either of you jump in and just let us know what kind of prep goes in on the pediatric side of things.
Go for it, Rich.
So, as Dr. Kumar alluded to, we've been doing this for several years. We have a pretty big, comprehensive team, and that goes from the nephrology, renal doctors that get to know the family, all the procedures they do. We have child life, which is pretty important for these kids to help kind of decrease their fears. Nurses, coordinators, there's multi-levels, multiple people that are involved with this to help guide these families, patients through this process. And it actually goes extraordinarily well. And we have a dedicated pediatric hospital, freestanding, anesthesiologists, nurses, OR team. We have our own dedicated OR transplant team. So all these little pieces to this puzzle to help facilitate this to move forward and have great outcomes. And talking about the energy mom, I kind of explained it. I told you this several times. Putting a kidney in a kid in renal failure is like putting a V8 engine in a Volkswagen. You really kickstart them and give them a lot of energy after that kidney's sewn in there and starts working.
So how soon after, Jessica, did you start to see a change in Brendon?
It was within a couple of days, once he got over the medications that were making him a little bit drowsy and got through some of that pain. it just immediately started turning around and had that high energy.
The boy that you expect to see, I know. So you were told that in May that Brendon wasn't ready for a kidney transplant, but what changed between then and your surgery?
Well, actually in May, it was a call that we got that we had a kidney from the deceased donor list. And after reviewing the case, they decided to turn that kidney down. Just the distance where the kidney was, it would have taken too long to get here. And so we had the call that it was there, and then we got a call that we didn't have it. So that put us back on the waiting list, and it was actually a very devastating moment for us and our family. So I think it was at that point where we were like, okay, I need to go through evaluation again. I need to make sure that we get a date set, because I can't go through the unknown and if we get it and then get it taken away again.
So when you say go through the evaluation again, what do you mean? Had you gone through before?
Yeah, so 3 years ago, I went through the evaluation at KU Med, just the workup, blood work, seeing all the different doctors and everything. So having to make those appointments again, get new labs drawn, and make sure everything was still healthy.
So what was the news like when you found out that you were able to do this?
It was very surreal. I knew that I had made the goal that I had set out for, but I just didn't know if it would be enough, if it would be the thing that actually made our lives so much better. So that moment was just very, very surreal, very sobering, very emotional.
Those pictures say it all. I love those. Great photo shoot. We have some more information on our living donor kidney team that helps guide our donors and the recipients through the process. You can scan the QR code on your screen there for more information about the program and about what we're talking about today. I want to take a quick break and check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control this morning.
Yeah.
You've got our COVID count. How are you?
I do. Hi. Doing pretty good. It's chilly out there.
It is.
So, unfortunately. So yeah, for our numbers today, we are still having lower numbers, which is great. We have 16 active in the hospital, 0 in the ICU, 0 on the ventilator, which is good. Still 12 in that recovery period. So overall, continues to look better right now.
Okay, a couple quick headlines for you. So this should not come as any surprise,
Yeah.
but there was a Boston study that found that mask wearing is associated with less spread of the disease in schools. Researchers compared COVID cases before and after a mask requirement was lifted. So how does this type of information translate to now?
You know, I think this translates to really every time period, certainly for infection prevention methods, non-pharmaceutical interventions. We know, and we heard Dr. Stites say, that his patients with lung transplant have been wearing masks forever. We know that our BMT colleagues, their patients wear masks. We know that helps reduce disease. There was always that debate over whether masking really helped. We know there was a large Bangladesh study, the randomized controlled trial, that showed masking did reduce rates of infection and therefore also rates of death. This is a local study looking at masking in schools. We know that was such a hot topic as well, and it showed that actually masking did help reduce cases around that area. So I think this is one more big piece of evidence and data that we can use to support the fact that masking does help reduce SARS-CoV-2 infection. But also, as we saw the last couple years, as compared to this year, it also helped reduce other respiratory viruses such as influenza.
So our tiny guest today, Brendon, he just got over RSV, still kind of getting back to himself in the hospital right now, should go home in a couple of days. But new numbers show RSV hospitalization rates for seniors. It's not just the young ones, it's the seniors. It's 10 times higher than usual for this point in the season. Why is this concerning, and is there any way to kind of stop this or slow this, or is it just what we're going to have to deal with this season?
Well, I think this is concerning in the context of everything. Number one, hospital surges, the capacity to take care of patients, these beds being taken up. So it certainly is a concern, but also the morbidity and mortality associated with RSV, not only in the very young, but also particularly in the elderly as well. So it is certainly concerning. We know that right now we have more patients with RSV in our hospital that are adults compared to children. But again, that's in the context of this being more of an adult health system compared to our total pediatric beds. So, but we know that it does cause hospitalization and severe disease. Luckily, we hopefully have several vaccines coming out. Number one, that will help protect mother and baby, but also candidates for the elderly population as well. Hopefully those will be available by next season. But anytime we have people in the hospital, it's always concerning, and we know that RSV can cause deaths, especially in those elderly as well.
All right, Dr. Hawkinson, thank you. Any reporter questions on the line today? Well, let's get to some questions from our viewers. And this is for Dr. Molapudi or Dr. Hendrickson, our Children's Mercy team. Will Brendon still have kidney issues or risk of UTIs with his new kidney?
I can take that. As with any kidney transplant or any organ transplant, you need to be on immunosuppression, which is the biggest reason why children are more susceptible to infections and such. But over time, your immunosuppression goals go down, and basically your infection risk should also go down slightly. There's always a chance for UTI because when we plug in the new kidney and when we put in the ureter, it's on a different location on the bladder, so that's a small possibility. But otherwise, I think we see most transplant kiddos live healthy lives. I've seen transplant kiddos from young age and from teenage years become doctors, and I was trained by a surgeon who had a transplant himself. So sky's the limit. Most of these kids, we hope they're running around playing soccer and going to school and growing up.
Dr. Hendrickson, do you know what causes prune belly syndrome?
Yeah, it's just a genetic disorder, something that happens early on. And, fortunately, he's actually done extraordinarily well. And with a center like ours that has experience in some of these conditions that are pretty rare condition, with all the multidisciplinary teams, you can usually manage these kids pretty well, as seen here by kidney transplant and a prune belly that's had a laparoscopic G tube. He's had the other issue was his bladder issue that we haven't got into either, and so he's had a lot of surgeries by our pediatric urology colleagues that have helped facilitate not only does a kidney make the urine, but we also have to get rid of the urine. So he's had undescended testicles, he had bladder issues, ureter issues, and so all that. And actually with his operation, we have one of our pediatric urologists in that procedure. So he's had, I think, around 15 operations just for ped surgery urology, somewhere in that area, for a kind of a rare condition that he has.
So, Dr. Hendrickson, what do you think life will look like for Brendon in 5 years? So, Sophie wants to know, what's the 5-year plan, and what does that future look like?
5-year plan, doing well in school. Like I mentioned before, he's extremely smart. I've known him for quite a while. He's a really bright child. You can tell that, and his mom will contest that. So being in school, a normal child, and doing the normal things that he wants to do.
And he'll continue to be checked out and continue to see you. It sounds like you'll be in his life for a while, in a good way.
Yeah, our nephrology colleagues follow them, check laboratory values. Dr. Molapudi had mentioned that they're on immunosuppression, so you kind of follow them with their therapeutic levels of that, but you also watch for the infections or some of the things that kind of pop up, the viruses that'll pop up that can cause some problems if you're on that immunosuppression. So yeah, lifelong marriage with the nephrologist.
Well, and I would imagine, though, that, and just kind of on that note, what is it like, though, to have this bond with these families? I mean, you see him smiling back at you. You guys are waving and flexing your muscles. I would imagine it's quite a bond.
Yeah, it's a great bond, especially with the parents. We'll kind of pass him in the hallways with the kids. And Jessica and I had a lot of talks over the summer about things we've already talked about, trying to lose weight and stuff like that. So heating your food in the middle of the night there. So you kind of get to know him really well and have fun and have discussions and keep light of the situation. But as you know, she's a hero, and he's got a new kidney, and he's doing great. Set back a little bit with this infection now, which they've talked to before, as our hospitals at capacity or above capacity with RSV and the other influenza viruses going around, respiratory. So we're trying to get through that. But you can see he's a great young kid and awesome family.
Couple more questions. Leslie wants to know, does it change the treatment plan since you used a living donor versus a deceased donor? So is there different requirements on the type of kidney that is able to be transplanted into a pediatric patient? Is there a different criteria? Is there something you prefer?
Do the argue on that, or
yeah,
couple of.
So when we think about different organs for kiddos, basically you have two routes. One is a deceased donor route, and one is a living donor route. When it comes to kidneys, not always true with liver or other organs, is, we do recommend, if you do have a living donor, friend, family, or acquaintance, or even an altruistic donor, that living donor has better outcomes than deceased donors, because the ice time or the cold time is really short. And also it comes from a very healthy donor as well. And they tend to last longer than a deceased donor as well. Most of the time, we quote that a good kidney should last about, 20 years, but it could be much shorter than that if you have repeat rejection episodes. It could be much longer than that if you really take good care of itself, a really good care and are immunosuppression, no rejection issues and such. So those are the things. Sometimes, if you have social constraints and if you don't have an available living donor, then we do go through the deceased donor route. For kiddos like Brendon, where because of the prune belly, you can pretty much fit most size of the kidneys. So when we look at babies that go on to transplant, we're looking at least 10 to 12 kilos of weight and about 75 centimeters or longer in length for babies before they can fit an average-sized adult kidney in their belly. When we do the operation, we kind of stay outside the belly compartment, so it's kind of more underneath the muscles, and we go find the blood vessels, which is either iliac blood vessels or the big aorta and the IVC type blood vessels, to put the kidney in. So the size does matter based on how big the kiddo is. But once the kid is a toddler age and such, you can pretty much fit any size adult kidney in your belly.
I want to get to final thoughts from our guests today. And Jessica and Brendon, let's start with you.
We are just so thankful that we've had all this experience at Children's Mercy, and knowing Dr. Hendrickson, knowing Brendon's nephrologist and urologist, the team that we've worked with since birth, basically, it's meant so much to us to have them to rely on and to have them care for Brendon as much as we care for him. And this is a life-changing thing. We can finally focus on Brendon being a normal kid. And, he started kindergarten after his transplant. He's doing things that regular kids do, and it's been long awaited. We're just very, very blessed.
Brendon, can we get a little wave from you? Pal, thank you for being on with us today. It's a lot to ask.
Yeah.
Yeah, it is. I get it. I feel you. It's hard to get up early, isn't it? Anyway, Jessica, best of luck with all of you. Stay in touch with us, and we just wish you all the best always. Dr. Hendrickson, your final thoughts today.
No, it's a great story. Thank you very much. Jessica, Brendon, do great. Get out of the hospital, and expect to get a graduation card here pretty soon. Top of his class.
Love it. Love it. Dr. Mullapudi, final thoughts from you today.
Yeah, great story. I'm so happy for you, Jessica and Brendon, that we've come so far, and I've had a chance to take care of Brendon as well, even though I haven't been here since his birth. One thing I do want to say from the programmatic standpoint of things is that I'm very new in Kansas City. I've been here about 10 months now. Came here to work with Hendrickson, and we're both great partners. And I was super surprised. I've never lived in Kansas City. I was super surprised to find this excellent children's hospital that is really renowned. Our Children's Hospital transplant program, our kidney transplant program, is #2 in the country for outcomes. and the outcomes have been 100% for 1-year outcomes and 3-year outcomes, which is a rare find that we have right here. And before coming here, until I was entertaining this job, I had no idea about. So I'm super glad that the kids in the community and our region has such an outstanding hospital here that takes excellent care of kids like their own.
Well, Doc, welcome to the city. Glad you're here, and thanks for all the work you're doing with our kiddos. We appreciate you so much. Dr. Kumar, final thoughts.
Yeah, Jessica and Brendon, thank you so much for trusting me to be involved in your story. I'm honored. I'm glad you guys are doing so well, and I can't wait to see what holds in your future.
Dr. Hawkinson, final thoughts.
Yeah, again, thank you to the colleagues and the continued collaboration. Again, we collaborate all the time, Dr. Kumar and I and other guests, but also the collaboration with other institutions as well. And so I think that is really what drives us to be able to help you and your loved ones to get back to that quality of life you want and stay there and stay healthy.
Thank you, Dr. Hawkinson. All Things Heart is coming up here soon at 10 a.m. Host Alexis Del Cid joins us now with a preview. Good morning to you.
Good morning, Jess. If ever there was a survivor, it would be Vicki Opaleski. Her battle with cancer began at age 11. Then came her heart troubles that hit decades later as an adult. The heart troubles were caused by her childhood cancer treatments, and Vicki had the toughest time trying to find doctors who could guide her through this struggle. That is, until she came here when she discovered a special clinic at the University of Kansas Cancer Center, tailor-made to help patients just like Vicki.
It's something that I only dreamt about happening. You think that you're fantasizing when you say, oh my gosh, I wish that somebody would I wish there was a place that I could go that they would handle it all and know what I needed. And I found that place. It's surreal almost.
So coming up at 10 a.m., we're going to talk about the clinic here. It's one of only a few in the whole country. You'll get to ask questions of Vicki, and you'll also get to speak with the specialists who've helped her get back to living rather than just managing her health, which was her full-time job. She's living again. That's all coming up at 10 a.m. on All Things Heart.
Alexis will be watching. Thank you all so much for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Coming up tomorrow on the Morning Medical Update, experts are zeroing in now more than ever on the mental health of students, especially those involved in sports and other school activities. We'll show you how these videos aim to give both parents and students the tools to keep their mental well-being front and center. See you tomorrow at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.